I'm Colonel Dr. Ronald Nagamba Mulindwa. I'm the Chief Executive Officer of the UPDF National Referral Hospital, a new facility that is expected to be commissioned by His Excellency, Commander-in-Chief of the UPDF Defense Forces soon. You know, projects are always started to address societal problems. So as a society, as a community of the UPDF Ministry of Defense, in particular, and as a wider community of the country, Uganda, we have had a long-standing healthcare problem. And this has been and continues to be a problem in terms of healthcare infrastructure and the supportive resources. And because of these inadequacies, both in the UPDF and in the country, the quality of healthcare, as defined by the different tenets of quality, are inadequate to meet the requirements of the population. And for the UPDF in particular, this has wide implications on the performance of the troops, and therefore has implications on national security. Our patients, that is the soldiers and their entitled families, have been having challenges of accessing quality health care, and this one has also been impacting on the overall cost of health care, because we have been referring many of our patients to other facilities outside the UPDF Ministry of Defense, within the country and outside, and this has been coming at a very big cost. So to address the challenge of access to quality health care and also contain the cost burden of health care on the institution, the leadership felt and thought it wise to establish an hospital of this level. So basically, that's the background of the problem, and this project comes as a response, as a solution to that long-standing problem. But it's not only limited to the UPDF. This asset is also for the country. That's why the target population extends beyond the UPDF to the general public. So it's also an addition on the national healthcare infrastructure.
Okay. So what's the current status of this general hospital?
Yes, status can be defined in a number of ways, but if I got you well, we can look at status in terms of the development of the project. And this project has largely been phased. It has different components within it. And the major ones are the physical infrastructure. The physical infrastructure is almost done. We are just making the final finishes, and the engineer's estimate is that the infrastructure is 99% complete. But because healthcare runs on several pillars, actually there are 6 pillars, infrastructure is one of them. So the other pillar for which the status is important to understand is the medical equipment. Because a facility of this level and the way it has been planned, it is supposed to operate using modern state-of-the-art techniques and technologies. So equipment has been procured, and we are now at the stage of delivery of the equipment, installation of the equipment, testing the equipment, and also conducting user training. That is how the contract was designed. It's a comprehensive package of delivery, installation, testing, user training, and eventually commissioning. Now, with the infrastructure at 99%, so the process of equipment is also ongoing, and it is at around 50%. Because the equipment, we have so many departments and so many equipment, so the scope of the equipment is very wide. And we have different providers who are specialized in the respective equipment. So these ones are at different stages of delivery of their contracts, but overall, the equipment status is at about 50%, and we expect that by close of March, we would have reached 65%, and then by the end of the financial year, by the close of June this year, we shall be at around 95%.
Okay.
Yes. Of course, there are other pillars. Human resource is another very critical pillar. And the process of putting in place the necessary human resource is also ongoing. Currently, we have been able to raise up to 50% of the required human resource. And this is being mobilized from within the UPDF and from within the market, the wider Ugandan market. But we are also in advanced stages of also recruiting expatriates from other friendly countries from other continents, and the process is also ongoing. So we expect that by the end of the financial year, our human resource will also be at around 75%. But status can also be viewed in another way. It can also be viewed in terms of the level of health care that the facility is to provide. And this hospital is a 275 bed capacity hospital at the current phase, but there is also a subsequent phase where we shall have an additional 100 beds for cancer and the heart unit. Yes, so when it is fully complete, it will be 375 beds. And it is a multi-speciality tertiary level of care hospital. In the Ugandan sense, it is at the level of a national referral hospital. But status can also be viewed in terms of the percentage of operationalization. At which level of operationalization are you? Of course, a project of this magnitude, you would not want to start everything at the same time. It's always wise to start by piloting, and then you open up departments one by one. So far, we have operationalized the outpatient and the daycare unit, and these ones have been running for the last 3 months. And day by day, of course, we keep checking the performance of the services that we have operationalized, make adjustments, and then plan for the subsequent phase. So in terms of status, that's what I can say for now.
UPDF constructed a national referral hospital in Mbuya, which is nearing completion.
Well, the project began way back. We have been at it for the last 7 years. Yes, we have been at it for the last 7 years, and the cost largely so far has been in terms of the infrastructure and in terms of the equipment. The cost on infrastructure is the last figure. Of course, there have been adjustments along the way of necessity, because when you look at a period of 7 years, many things change, and at times you need to make adjustments. So the contract sum at the stage where we are for the first phase is 130 billion. That is on the civil works, and 105 billion on medical equipment. So those ones have constituted the major cost contributors for this project. The other costs will be more of running costs rather than capital costs.
Colonel Dr. Ronald Nagamba, the CEO of the UPDF National Referral Hospital, said the facility meets international standards and will serve military personnel and civilians.
Like I said in the beginning, we have a challenge of health care as a country, and as we know, health care has been prioritized by government in view of Vision 40 and all the respective national development plans have had a high concentration on health care, of course appreciating that health care is key for the rest of the pillars of the national development plans and of Vision 40. You cannot have social economic transformation when you are the people who are supposed to make the transformation are sickly and unproductive. So the country has put a lot of concentration on health care as a pillar for its social economic transformation program. And this project directly speaks to the vision and to the national development plans, because we said that it's not only looking internally UPDF, but it's also a national asset. And when you look at the services that are going to be provided here and the quality that is going to be provided here, the facility is going to improve access to quality health care, both to service personnel and to members of the general public at a tertiary level. So you will find that even many of the conditions that the country has been referring abroad will be managed here, therefore containing expenditure on health care for the country. So it is going to make a major contribution to health care in the country and also to the national development agenda. Of course, sustainability in the country is a challenge because of the model of funding that the country is operating. Of course, you are aware that their plan is to introduce national health insurance, but this one has not been realized yet. And of course, that one speaks to the challenge of funding, health care funding. Health care funding in the country is not yet at par with the need. And that's why you find that when infrastructure is put in place, it cannot be sustained in many cases. So this problem is not only in the wider Ugandan setup, but it has also been a challenge within the UPDF health care system. And it was on that basis that the leadership decided that this facility, the services will be provided at a fee. And like I told you in the beginning, we have two broad categories of patients. We have the UPDF Ministry of Defense entitled patients, and that is the soldier, the spouse, biological children, and also biological parents, because you want to provide a package that will keep a soldier comfortable and able to concentrate at work without worries that him or herself, or a loved one is sick and not getting the care that is required. But the hospital is also going to be open to the general public. And we are looking at the Ugandan public, but we are also looking at the region. We are also looking at the standards here. We expect that we shall also attract patients from the region, the East African region in particular, and probably even beyond. Now, the entitled UPDF Minister of Defense patients will not have to directly meet the cost of their treatment. The burden will be put on the UPDF Ministry of Defense headquarters for the patients treated, and then the ministry will clear the bills. But for the other category of patients, that patients from the general public, patients from the region, they will meet the cost of treatment either out of pocket or through an insurance scheme. Now, this will address the challenge of sustainability in terms of financial resources. But being affiliated to government and being a facility of the UPDF, which is the People's Army, a decision was further taken that it will operate on a model of a private, not-for-profit. So this hospital will not be generating profits for members to share dividends at the end of the financial year. So the cost of treatment will be kept low, and this will enhance affordability and access to health care by members of the general public. And by that, we expect that we shall be able to raise adequate resources to sustain the quality and the standards that we have set.
The hospital comprises of 6 interconnected blocks. Among its standout features include the emergency evacuations, VIP treatment suites, and advanced diagnostic and surgical department.
Monitoring and evaluation is certainly key. Now, the organization of this hospital is that above top management, we have a board of directors, and the board of directors is constituted by eminent members of the society, and these are from the health sector, they are from the economic sector, and also representation of the private sector. Now, the board of directors report to the owner, who is the Ministry of Defense, UPDF. Now, through this system, targets are set, policies are done, instructions are given, and management implement the policies that have been given in order to meet the targets that have been set. And along the way, monitoring is carried out at the different levels by the different players to ensure that the hospital remains on course and that it's meeting the targets that have been set. So that issue has been addressed by the structure of the hospital, both at management and at governance. And of course, that is the UPDF. That is the uniqueness of the UPDF compared to the previous armies that we had in this country. The uniqueness in terms of being a pro-people army, the uniqueness of being a politically conscious army that is aware of the challenges of the country, the aspirations of the country, and the path that has been put in place It's the uniqueness of the professionalization that His Excellency the Commander-in-Chief embarked on some time back, and of course we are seeing the results of the professionalization. Now, a professional army has to be a productive army. A professional army must contribute to the development agenda of the country. And development and health care move together. They synergize each other. So investment in health care in any economy is key for the growth and the development of that economy. And the military is a key player in the whole process. So that's why the professionalization agenda that the President started has been very instrumental in transforming the institution of the military from where it was to where it is, to a level where the military is engaging in production, where the military is engaging in activities for the socio-economic transformation of the country. And it has only happened in the UPDF. It did not happen earlier, because the agenda of the current government is different in a way from the agenda of the previous governments. Yes, and it's not only health care. UPDF is involved in development activities in various sectors. We are seeing the defense industry developing. We are seeing the contribution of the UPDF to national development become more entrenched by the passing day. There is a lot to celebrate. Of course, the Ugandan population, the way it is now, is constituted by majority of people who were not there before the Tarehe Saturday, the 6th of February, happened. And they can only get to know when the people who were there tell them how things were, and then they can have an opportunity to compare. But of course, also because of the government's program of education, emphasis on education, most of the young people now are literate, and there is a lot of information. It just needs to stimulate them to take the interest. There is a lot of information about how things were and how things are that an interested mind can search out for. But the reality is that we have made very big strides from where we were and where we are. Before the current government came into power, the military was one of the hated institutions in the country, because the military was notorious for human rights abuses, and there were lots of killings by the previous armies. But when the new government came, the military was reshaped into a pro-people's army, a military that believes that it is because the population is. That's why wherever we are, we make sure that we are in harmony and we listen, and also where possible address the concerns of the population. The population and the military, we are one. And this is a transformation, because this is not how things were before. You must have heard stories of how people would run away whenever they would spot the military. But now when somebody is in danger and spots the military, then relief comes that with the military in the vicinity, I'm safe. So that has been a major transformation that has contributed to the stability and to the development that we are seeing in the country. In all aspects, because the military has ensured the defense of the country, it has ensured security, and of course everything, development moves on security. Where there is no security, you do not expect any development. So all the gains that have been registered have been because of the transformation that occurred, a transformation that was triggered by the activities of the operation of the 6th of February. So as a country, there is a lot to actually be proud of, and there is a lot to derive hope from, looking at where we were and where we are. You know, some people can look at these years and think that it is a long time. But when you compare, there are other countries that have not made any considerable strides within that time. A lot of time, or a lot has actually happened, and the foundation has been laid and is now being solidified, and we are sure the future is very bright thanks to what happened on the 6th of February. And of course that is thanks to the professionalization agenda that was initiated by His Excellency Commander-in-Chief of the UPDF. So it is an act of professionalism. It is an act of dedication. It's an act of patriotism. In many cases, actually, patients think that our drugs are different from the drugs that are available in the other private and public facilities, yet the drugs come from the same source. We get most of our drugs from the national medical stores. But you know, health care is a package. It is not only buildings, it's not only drugs, it's not only infrastructure. It's a blend of the various pillars speaking to each other and synergizing each other. I think our difference is the care that we provide to the patients. Not that our infrastructure has been much different, not that the equipment has been much different, but it's that touch of the care as derived from the patriotic mind and the commitment to serve the country and the people, being a people's force. So where we are, we share with the communities and what we have, the little that we have, but in a spirit of care, in a spirit of patriotism. But I also know that also a lot is happening in the public health care sector. The Ministry of Health, looking at the national development goals and looking at the national development plans, is also doing much to uplift the capabilities and the quality of health care in the public facilities. Of course, mindset change does not come in a day. It's a process, but I'm confident that with what I'm seeing being put in place, even in the public health care system, strides are being registered. And I know that within a limited period of time, the quality of health care shall also improve. We just pray that the journey that was started on of the National Health Insurance Scheme comes to fruition, because I believe that it will come in handy to address one of the critical challenges of the public health care system, that is the challenge of funding. I know there is a lot of excitement, there is a lot of expectation. Of course, people have trust in the UPDF and in the UPDF systems, notably the UPDF health care. So there is a lot of expectation, and people have been asking, when are the doors being opened? When are the doors being opened? Like I told you, health care is a complex organization. It's a complex industry that is dependent on several inputs which speak to each other and synergize each other. And I've told you that the infrastructure is at 99%, equipping is at around 55%, and the human resource is also following in the same range. But we are expecting that by the end of this financial year, we shall be safe in terms of the different pillars to open the hospital to the community. And we expect that not very far from now, I might not be able to tell the exact time because that is not my mandate, but from the plans and from the developments registered, I'm certain that not very far from now, most likely before the end of this financial year, the hospital will be commissioned and opened for the public, and the public shall certainly be notified of these developments, because this is their facility, and the facility has been set up to, among others, provide health care to them. Just to sum it up, that this facility is coming as a national referral hospital to serve not only the UPDF but also the general public, and it's coming up as one of the interventions to address the long-standing health care challenges in the UPDF Ministry of Defense and in the wider Ugandan public. Because of sustainability, the services at the hospital shall be provided at a fee, but being a UPDF facility and therefore affiliated to government, it's an entity, it's an asset of government, the services shall be provided on a private, not for profit, such that we can keep the services affordable in order to be able to meet the challenge of access and quality. So UPDF, wherever it has been, the health facilities are open to the general public, and it shall be the case here. So members of the public, once the facility is open, it is your facility and it has been established for you. So feel free to come and enjoy international standard care services at the UPDF National Referral Hospital. So we are doing all it takes to make sure that the vision of being a premier specialized health care provider and leader in health care training and research is met through a mission of applying modern state-of-the-art techniques and technologies. So thank you very much, and we look forward to having the hospital commissioned and opened for use by the general public, which I'm aware is already eager to receive the services. Thank you very much.
Uganda.